Now in its fifth year, Brockton Knocks Down Diabetes, which is a coalition of Brockton's healthcare providers, community organizations, and businesses, continues to combat the growing public health crisis in the state's seventh largest city, which is diabetes. Now, data shows that Brockton has the rates of diabetes-related hospitalization that are nearly twice the state average. Last year, this coalition, led by the Old Colony YMCA in Stoughton, secured a $1.2 million grant to fight diabetes and other chronic diseases in the communities of Brockton and Stoughton. Now, to tell us more about the work going in these two towns to fight the growing issue of diabetes, we've invited our good friend Alberto Whitaker, whatever you want to call him. He is the Director of Community Partners of the Community Director of Partnerships and for the New England for the American Diabetes Association. And I like this real name. This is Al, sorry, but Kendall Bennett, Old Colony YMCA REACH Program Coordinator. I don't know what REACH means, but I know it stands for something, right?
It does.
So I'm going to start with you because he's been here many times before. Welcome to Revista Hispana.
Thank you so much.
So let's start with that. REACH Coordinator. What does REACH stand for?
So REACH is a program from the Centers for Disease Control and Prevention, and it stands for Racial and Ethnic Approaches to Community Health. And so it picks different communities throughout the entire country and focuses on a particular health problem and a particular ethnic minority group.
Which is the situation here, right, Al? What is going on in Brockton that this chronic problem is so high?
Well, I would venture to say that part of it is access or lack of access. Right. And that's access to fresh fruits and vegetables, access to proper health care, and the myth, you know, I grew up in a culture where the bigger you were, the more prosperous you are.
I see.
And so to eat whatever you wanted to eat. And so to really start talking about eating healthy and changing the mindset, that is one of the, you know, the strengths that we hope to have with this whole Brockton Knocks Down Diabetes.
So it is, so you mentioned culture, right? Mm-hmm. So that speaks to the demographics
exactly
of that area, right?
Mm-hmm.
Which, how do you describe that?
So there is I would say the highest percentage is population is the Cape Verdean. Yep. And then we have Haitian Creole and then African Americans and some Latinos. And, you know, with all of those particular cultures, you know, there's cultural foods that go. I mean, rice is a staple, right, but rice is also a carbohydrate, which can definitely elevate your blood sugars if the intake is consistent. So how do you kind of teach people how to eat better or eat in smaller portions, or, you know, continue to eat what you're eating, but let's watch our portion sizes so that we can be healthier.
Now, it sounds like such a big task that no one organization could probably ever do this by yourself. So the coalition comes together, right, and is bringing a lot of different folks to the table. Tell me a little bit more about that, how this is kind of bringing everybody together.
So Harbor One, actually 5 years ago, started Brockton Knocks Down Diabetes and brought the Old Colony YMCA in as a big partner. And it started as this 1 week of free events. And over time, they've brought in over 40 different organizations from healthcare, schools, you know, anything and everything is there at the table, and everybody shows up to plan these great events. And you know, the good news is that coalition is so strong, we're able to leverage it and apply for funding, and we're able to kind of extend that throughout the year and offer a lot more than they were initially able to do just as a few organizations.
Now, we're looking at some photos. Is this part of last year's event for the June event? Was it Brockton Knocks Down Diabetes? So these are some of the folks from last year and some of the events that go on. It's a real kind of, it's not week long, but several days, right, that go on?
Well, it is a week long.
A week long, okay, so it is a week long.
Actually, it begins June 11th will be a kickoff
okay,
that is sponsored by Signature Health. But it's a kickoff where there are screenings, there are opportunities for people to get education, the whole kit and caboodle. But what's beautiful about it is throughout the entire week, people in the city of Brockton and in Stoughton have access to many of the facilities in Brockton, and they can go for free. So if they want to have a cooking demonstration or want to go to Zumba or want to go to the Y, all of those things are free for that week. And guess what? You know, it's starting to make a difference as far as we're beginning to see a reduction in, number one, the amount of hospital visits, but also we're raising awareness about diabetes education and the impact diabetes can have on someone's life.
And that's what I said. So you're raising awareness and you're raising funds. So what are you doing with the funds? How is this kind of playing into it?
So because of our demographic information, we did qualify for this REACH program, especially because we have twice the state rate for hospitalizations, but if you look at our minority groups, the African American and Black population in Brockton has 4 times the state rate for hospitalizations. And there's really no physiological reason that makes sense. It's because we as a community are not equally feeling the burden of these healthcare conditions. So what we're trying to do with these funds is to take a multi-level approach. We are doing some screenings out in the community. We're using it to contact groups that have a lack of access, as Al mentioned before. So we're meeting people where they're at. We're going to churches and holding screenings after Mass, and we're bringing, interpreters, and we're taking down those barriers like transportation and language to really make sure people know if they're at risk or if they have a chronic disease, and then after that to really make sure they get enrolled with a chronic disease self-management program, a prevention program, get them hooked up with a primary care provider so that they really can take control of their health.
Sounds like you guys are
going
going into the community and really being proactive using
Absolutely.
this. All right, so I'm going to put the information one more time. June 11th.
June 11th.
So folks, get ready. I know this is its 5th year. You've got some plans for this to keep growing, right? This is definitely the first 5 years, just the beginning. June 11th and 18th. And for more information, we've got up there. You're on Facebook. You guys are on Twitter. You've got a nice website. And good job, Al.
Thanks.
Thank you for coming by again.
Thank you again, Alberto.
All right.
you.
Say hi to my friend Alex Bloom.
I will.
Yeah.
We will.
Yeah, he's my buddy now,
Okay.
texting at me at 1 in the morning. All right, anyways, thank you, Kendall. All
Thank
right.
you very much.
All right, that's it. When we come back, a local pageant that wants to go national to showcase the beauty and talent of young Dominican women. For all the details right here on Revista Hispana.